Antiseptic surgery is a medical practice that involves the use of antiseptic agents to reduce or eliminate harmful microorganisms that may cause infections during and after surgical procedures. This practice was first introduced by the British surgeon Joseph Lister in the 1860s and was a significant breakthrough in the field of medicine, as it greatly reduced the number of deaths and infections resulting from surgery. Before the introduction of antiseptic surgery, surgical procedures were often performed in unsanitary conditions, leading to a high incidence of infections and deaths. Lister's use of antiseptic agents such as carbolic acid drastically reduced the risk of infection and made surgery much safer. In addition to antiseptic agents, other improvements have been made in surgical practices, such as sterilization techniques, better understanding of surgical anatomy, and the development of surgical equipment and techniques. However, there is still room for improvement in the field of antiseptic surgery, including the development of more effective and less toxic antiseptic agents, improved methods for monitoring and preventing infections, and continued research into new surgical techniques and technologies. Some specific areas where antiseptic surgery can be improved include antiseptic agents. While carbolic acid is still used in some surgeries, newer antiseptic agents have been developed that may be more effective and less toxic. For example, chlorhexidine and povidone have been shown to be effective in reducing infections and have fewer side effects than carbolic acid. Infection monitoring and prevention. While surgical teams take many precautions to prevent infections, they can still occur. Improved monitoring and prevention techniques, such as real-time monitoring of surgical sites and the use of predictive algorithms to identify patients at higher risk of infection, could help reduce the incidence of infections. Minimally invasive surgery. Minimally invasive surgical techniques, such as laparoscopy, use smaller incisions and may have a lower risk of infection. Continued research into these techniques could help make surgery even safer. Surgical education and training. Proper surgical education and training are critical to ensuring safe and effective surgeries. Continued improvements in surgical education and training, including the use of virtual reality and other simulation technologies, could help prepare surgeons for a wide range of surgical scenarios and improve patient outcomes. Overall, antiseptic surgery has had a significant impact on the field of medicine and has helped make surgery much safer for patients. Continued improvements in surgical practices and techniques, as well as the development of new technologies and antiseptic agents, can further improve patient outcomes and help reduce the risk of infections during and after surgery.